All right, so for the next classification of adrenergic drugs that we'll be looking at is what is known as a non-selective agonist adrenergic drugs. So for what we do is we just state their general use, state their examples just by listing. So later on, we'll still break it down by talking about their individual pharmacologies. All right, so in a group they can have similarities but one or two differences here and there. So let's look at this group. So just so you know, the non-selective adrenergic agonists, they are drugs that activate multiple adrenergic receptor subtypes. All right, this is some adrenaline, okay, Isoproterenol. All right, so typically both alpha and beta receptors, so they are non-selective. So this will now lead to widespread sympathetic effects. So these agents are powerful. They are often used in emergency medicine. Now this is because they have a broad spectrum of activity. They can act on any receptor once it is an adrenergic receptor. Right, so these are some of the examples. We have things like what? Epinephrine, also known as what? Adrenaline. Alright, epinephrine is also known as adrenaline. Then norepinephrine, also known as what? Noradrenaline. So these are the different types of receptors that they can act on. You can be pausing to look at it. Then we have isoproterenol. Alright, isoproterenol, dopamine. Alright, so mechanism of action is epinephrine. So they stimulate all adrenergic receptors, okay, like epinephrine stimulate all adrenergic receptors. You can see that alpha 1, alpha 2, beta 1, beta 2. They increase heart rate, bronchodilation, vasoconstriction. How about norepinephrine? Alright, so norepinephrine has what? Action on all of them except beta 2. Alright, so that one too is to boost blood pressure. Alright, strong vasoconstrictor. The isoproterenol is basically for the beta 1 and beta 2. Alright, this one is a potent beta agonist, increases cardiac output and all of that. Dopamine, alpha and the beta, alright, and dopamine receptors. Alright, so low doses affect dopamine receptors, higher doses, this one now depends on the dose, whether it will affect the beta, whether it will affect the beta, alpha or not. So side effects of these drugs is that they can cause palpitations, right? So they can cause anxiety issues, tremor issues, hypertensive crisis, all right, some irregularities in the beating of the heart and all of that. Okay, so clinical insights, they are also first line agents in resuscitation protocols. For example, epinephrine is the go-to drug in anaphylactic shock. This is due to its ability to be able to reverse airway constriction, then also support circulations simultaneously.